Welcome to my channel on Ankylosing Spondylitis. Today we discuss Ankylosing Spondylitis medication. Many people who have Ankylosing Spondylitis take medication to help reduce the inflammation that causes pain and stiffness. What type of medication a doctor recommends will depends on the person's symptoms and their severity. There are four types of medication commonly used to treat ankylosing spondylitis. Ankylosing spondylitis, an inflammatory arthritis and autoimmune condition, has traditionally been a challenge to diagnose. The problem is that it typically starts with back pain. Top 4 medication for ankylosing spondylitis. Number 1, non-steroidal anti-inflammatory drugs NSAID. Number 2, biologics. Number 3, corticosteroids. And number 4, DMARDs. Like all medication, these drugs can cause side effects or interact with other medication. Patients are advised to discuss any drug therapy plan with their healthcare professional and report side effect immediately. Top 4 medication for ankylosing spondylitis. The number are: number 1, non-steroidal anti-inflammatory drugs, or we can say NSAID. NSAID are often the first line of defense against ankylosing spondylitis pain. NSAIDs is a broad category of medication that includes over-the-counter NSAIDs such as number 1, aspirin, number 2, ibuprofen, and number 3, naproxen. Prescription NSAIDs, which have the same ingredients as over-counter medication but are packed in stronger doses. COX-2 inhibitors, sometimes called COXIPs, which are available only by prescription. Celecoxib, sold as Celebrex, is a COX-2 inhibitor. Number 2, Biologics. Biologic medication suppress immune system activity, thereby decreasing ankylosing spondylitis patient disease activity and symptoms. In some people, biologic drugs called TNF inhibitors, TNF blockers, as well as certain interleukin IL inhibitors appear to do one or more of the following. Biologics can: number 1, slow the progression of the ankylosing spondylitis. Number 2, treat peripheral joint pain. Number 3, treat spinal arthritis pain. Biological medications are administered with a needle, either injected under the skin or infused into a vein. Exactly how much and how often a medication must be administered varies significantly depending on the drug and the patient. Some ankylosing spondylitis patients may take medication once a week, while others get an infusion once every 6 weeks. Some FDA approved biologicals means biological injections which are FDA approved There are 6 FDA approved biological medications for ankylosing spondylitis. Number 1, etanercept inhibitor. Number 2, infliximab or Remicade, adalimumab or Omega. Number 4, nivolumab or Simponi. Number 5, certolizumab or Cimzia. Number 6, secukinumab or Cosentyx. These biologic medications are expensive. In addition, they carry potential risks and side effects, including possible infection resulting from a suppressed immune system. Number 3, corticosteroids for ankylosing spondylitis. Corticosteroids such as prednisone can also help relieve the pain and swelling of ankylosing spondylitis in the short term. However, because long-term use of steroids poses certain health risks, your doctor may be hesitant to prescribe them too often. Corticosteroids can be taken by mouth or injected into the affected joints. The sacroiliac joints in the pelvis, the hip, or the knee to provide temporary relief. However, they can be injected into the spine for ankylosing spondylitis. Number 4, DMARDs for ankylosing spondylitis. DMARDs may be prescribed if you have ankylosing spondylitis, but they are less likely treatment option. DMARDs work best if your knee or ankle are painful and swollen. Disease-modifying anti-rheumatic drugs or DMARD are class of drug indicated for the treatment of rheumatoid arthritis or RA factor, ankylosing spondylitis, and many other autoimmune disorders like spondyloarthritis, inflammatory mitosis, inflammatory bowel disease, systematic lupus, and some types of cancers. Although some people have both ankylosing spondylitis and rheumatoid arthritis or RA factor have had success with DMARDs, these drugs don't seem to help most people who only have ankylosing spondylitis. There is some data that sulfasalazine and older types of DMARD has some symptomatic benefits for people with ankylosing spondylitis, but it's not to the same degree you can obtain with newer drugs. Methotrexate, a common chemotherapy drug, may also be prescribed for treating ankylosing spondylitis. Doctors generally prescribe smaller doses of methotrexate for ankylosing spondylitis than they would if a person had RA. This medication can be taken orally or by injection. Methotrexate is not particularly effective for back pain due to ankylosing spondylitis. Finding the right ankylosing spondylitis medication for you. It is essential to work with your doctor to find a treatment plan that's right for you. People respond differently to different medication for ankylosing spondylitis. So, finding the treatment that works best for you may require some trial and error, regardless of which therapy you are on. However, you need to talk with your doctor about altering your treatment plan. If you don't see improvement after about 3 months, a treatment plan for ankylosing spondylitis can be tailored to your individual needs. Get the basic on the drug therapies available for this condition. Diagnosing ankylosing spondylitis early is important, though, because the sooner you begin treatment, the better. The right treatment can help keep your spine flexible and your joint moving. Treating ankylosing spondylitis may also prevent or delay permanent damage to your spine and other joints, including your hips and shoulders, which also may be affected. Ankylosing spondylitis, an inflammatory arthritis and autoimmune condition, has traditionally been a challenge to diagnose. The problem is that it typically starts with back pain, or we can call sacroiliac joints area. Treating ankylosing spondylitis may also prevent or delay permanent damage to your spine and other joints, including your hips and shoulders, which also may be affected. Unlike people with other forms of arthritis, people with ankylosing spondylitis sometimes report their symptoms lessen or even disappear as they age, while young people can hope for the change. It does not happen in all or even most cases. So doctor recommend all patients follow a treatment plan. Thank you for watching my channel. Please watch and share.